Hi, welcome to another episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal.
Today's episode, Paul, very interesting question from some viewers in our comment section. The question is, can I take ibuprofen and acetaminophen or Tylenol and Advil together?
Good question. So often, two pain relievers that are used very often, especially in our line of work. We see a lot of people in discomfort secondary to arthritis or other musculoskeletal conditions, and they need something to take that can help them with their pain.
And often in our videos, I find we don't necessarily directly answer the question. We say, hey, maybe this, maybe this. I think the answer here is yes, but.
Yes. Yeah. Thanks for watching. Okay, so I guess it's the but. So what are we talking about by mixing? Are you talking about like crushing these pills, mixing them together and taking it? Are you talking about taking them at the same time? Or are you talking about staggering it for a half hour?
So theoretically, you could crush them and mix them if you had like a swallowing disorder of some sort, which sometimes happens. But I think generally you mean like say in the average day or maybe over a prolonged period of time. And that could be either literally in the same handful or alternating, essentially concurrently.
All right, so yeah, you can take these two different types of painkillers at the same time for the same condition. And why is that? Why can we do that?
So a couple of reasons. The main reason is because of the way that they're broken down by our body. So anything that we ingest or take or are exposed to can cause us problems. And the problem is really based on how our bodies deal with it, whether they can deal with it effectively or not effectively. So acetaminophen-based products are processed by our liver, while as anti-inflammatories are processed by our kidneys.
Right, so a lot of times when you see a medication, certain types of medications that you can't mix together or shouldn't take together is because they're processed or excreted the same way.
Right.
Kidneys, if you take too much of those same medicines that the kidneys have to work at to get rid of, you're going to damage your kidneys or the liver. But in this case, as Dr. Wiening said, acetaminophen is treated by the liver and the anti-inflammatories are treated by the kidneys. So two separate systems in your body, so it's safe to take them at the same time.
Other important question, is it important? Is it worth it taking, like why do you have to take both? Why can't you just take one?
Right, so well, anytime you do any sort of treatment recommendation, as physicians we always look at the risk-benefit ratio, right? So a ratio is just a comparison of two numbers. So we look at the risks and the benefits and compare them. And we want to make sure that the benefits way outweigh the risks, right? So whenever you're choosing, not even in this case for mixing the two together, when you're choosing any treatment option, whether it's medication or surgery, you always want to look at the risk-benefit ratio, right?
Yep, absolutely. So is there a population of people, we'll start with acetaminophen, is there a population of people that should avoid acetaminophen?
Right, people who have liver dysfunction will have higher risk taking acetaminophen, so probably shouldn't, because that'll tip the scale in the risk favor as opposed to benefit favor.
So things like liver failure, cirrhosis, hepatitis, those kinds of things.
Yeah, liver problems. And then on the other hand,
ibuprofen.
Or any other anti-inflammatory.
Oh, yes, of course.
Right.
Yes. Processed by the kidney. So people that have kidney issues, so people that are on dialysis, or people that have borderline kidney function, or people that have really high blood pressure, which a lot of times is related to your kidneys, they should probably either proceed with caution or maybe not take it all. And again, all of this stuff should be discussed with your family doctor or your healthcare practitioner.
Yeah, if you're taking a medication, a new medication, you really want to bounce that off your family physician or your primary healthcare provider, because they know your whole history and they can tell you it's safe. But definitely things that affect your kidneys or problems with your kidneys, you want to avoid anti-inflammatories, and a lot of people say avoid long-term use of anti-inflammatories. Life is a risk-benefit ratio, isn't it? Really?
Haven't we learned that?
Yeah, like anything you do in life, you always look at the risk versus the benefit and then decide if you want to do that. Go on a plane ride, go on vacation, right? There's a small risk going on a plane, but the benefit is you go to a nice beach or a sunny location, right?
So, Paul, why can't I just take a whole bunch of acetaminophen then? I'll say, now you scared me about anti-inflammatories. Why don't I just take a whole bunch of acetaminophen?
Well, a lot of people do take a lot of acetaminophen on a regular basis, but for a few reasons. One, if you take too much acetaminophen, it will damage your liver, right? That's why there's guidelines on the bottle depending on the strength of the pill you're taking. Certain guidelines that say this is how much you should take per day.
Typically in the 3 to 4 gram range, but that's weight dependent as well as other medical issue dependent. Read the bottle.
Right, because that can eventually damage it over a period of time. And certainly long-term use of any medication can cause damage to that system that is involved in excreting that medication.
Yep. I think the other thing is that they work differently. So
Yes.
sometimes, like we've talked about in the past, multimodal pain control, if we have a different pathway that acetaminophen's on and the anti-inflammatory is on a different pathway, sometimes the cumulative benefit of both of them is greater than either on their own.
Well, absolutely, yeah. So multimodal approach, we talk about that a lot, like you said. And I'll often use a topical anti-inflammatory too, right over the area that's hurting.
Add some ice.
Physiotherapy.
Yeah, maybe a brace.
Yeah. One thing we don't suggest using a lot for chronic type pain before surgery or anything like that is a narcotic.
Agreed.
We often say don't use a narcotic because I don't think it's a good solution for a problem that is long-standing chronic. We see that in our population. We use narcotics in our patients after surgery for sure.
Yep.
But generally I don't recommend it before. But Tylenol or acetaminophen and anti-inflammatory we suggest a lot.
Absolutely. Just one other thing about the anti-inflammatories, it's not just the kidneys you have to be careful of. Certainly has issues with people's stomachs, so some people can get stomach pain, and people that have had heart attacks or strokes, often that's a contraindication or a relative contraindication. So again, clear it with your family doctor or your specialist before you take any of these kinds of things.
Yes. If you're taking an anti-inflammatory, you've got to be careful for your, definitely for your stomach because it can cause ulcers, and also the blood thinning properties of anti-inflammatories. If you're on a blood thinner for something else, then you have to be very cautious if you're going to be taking anti-inflammatories. Any other blood thinners. Yeah.
So back to actually taking them. So do we take them together? Like do you take the bottles and you like a big bowl like Smarties kind of thing, grab a handful?
I would not treat them like a big bowl of Smarties or M&Ms. But I mean, not that long ago it was said to take it about a half hour apart.
Right.
But I think nowadays you can take it together at basically the same time. And I think there are some pre-mixed preparations available where both acetaminophen and an anti-inflammatory are mixed in the same pill, and you take it at the same time.
A little bit of it's trial and error. Sometimes you might want the space to maximize your pain control. Sometimes you can get some stomach discomfort if you take a whole bunch of pills. So you probably have to figure it out a little bit. You always can talk to your pharmacist, another great resource as far as stuff like this.
Right.
But in general, kind of the take-home message is that yes, you can take them together. Proceed with caution. Make sure you kind of do your due diligence. Find out what you're allowed to take, what you're not allowed to take, and go from there.
Clear it with your healthcare provider for sure. But yeah, if you're wondering, if you're Googling, hey, can I take aspirin and Tylenol together? The answer generally is yes, unless you have a contraindication to one or the other.
So I think that's awesome. So if you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.